Hello, my name is Dr. Norris Azuma. I would like us to briefly discuss cholera. Now, what is cholera? Cholera is an acute diarrheal infection caused by ingestion of food or water contaminated with the bacterium Vibrio cholerae. A cholera outbreak can occur in both endemic countries and in countries where cholera does not regularly occur. The Ghana Health Service press release dated 14th of October 2024 informed the Ghanaian public that there was an outbreak of cholera in the Adan West and Adan East districts as of the 4th of October. And by 11th of October, there were 9 confirmed cases. As at today, the 26th of October, several other confirmed cases have been noticed with about 2 deaths in the area. Now, how is this disease transmitted? Transmission of cholera is by eating or drinking water or food contaminated with the bacteria Vibrio cholerae. Cholera transmission is closely linked to inadequate access to clean water and sanitation facilities such as hand washing facilities and toilets, allowing people to openly defecate and not properly wash their hands. Typical at-risk areas include peri-urban slums as well as camps for internally displaced persons or refugees, and overcrowded communities with poor sanitation facilities, such as toilets, hand washing facilities, and good drainage system. Now, should an individual have cholera, how will they present? Cholera can cause severe acute watery diarrhea, popularly known as the rice water diarrhea, and severe forms of the disease can kill within hours if left untreated. Most people infected with Vibrio cholerae do not develop any symptoms, although the bacteria are present in their feces for about 1 to 10 days after the infection and are shed back into the environment, potentially infecting other people. This is why we preach against open defecation. Among people who develop symptoms, the majority have mild or moderate symptoms such as abdominal pain, vomiting, and diarrhea. It takes about 12 hours to 5 days for a person to show symptoms after ingestion of this bacteria. A minority of patients develop acute watery diarrhea with severe dehydration. This can lead to death if left untreated. How do we prevent cholera? A multifaceted approach is key to control cholera and to reduce deaths. A combination of surveillance, water, sanitation and hygiene, social mobilization, treatment, and oral cholera vaccines are used. It means that the government should provide potable water for our communities. The Ghana Health Service should continue surveillance to ensure that there are no environmental samples of this bacteria, and education to our communities to practice good personal hygiene, washing of hands under running water with soap, using toilet facilities, and to avoid open defecation. Education to eat warm food and not eat very cold food. These are ways to prevent the disease. Now, should one be affected by this disease, how is it treated? Initially, for those with mild or moderate symptoms, the WHO or UNICEF ORS, oral rehydration salt, standard sachet, is dissolved in 1 liter of clean water. Adult patients may require up to about 6 liters of the ORS to treat moderate dehydration on the first day. However, severely dehydrated patients are at risk of shock and require the rapid administration of IV fluids, and as such should be admitted and managed in the hospital. These patients are also given appropriate antibiotics to diminish the duration of diarrhea, reduce the volume of rehydration fluids needed, and shorten the amount of duration of Vibrio cholerae excretion in their stool. Breastfeeding babies should continue breastfeeding. Zinc tablet is an important adjunctive therapy for children under 5. Let's all practice good personal hygiene, keep our environment clean, ensure the availability of good sanitation facilities in our communities. Let's kick cholera away. Thank you.